This week on Physio Foundations, I'm talking to Luke Nelson, aka Sports Chiro Luke, about the pathway he's been on from new grad practitioner to highly experienced sports chiropractor and then a leader within his profession. Welcome to the Physio Foundations podcast for another week, a podcast about the knowledge and skills that provide the foundation of expert clinical practice. I'm your host, Luke Periton from Monash Uni Physio and from Periton Physio. And this week I'm talking to another Luke, Dr. Luke Nelson. So Luke's a sports chiropractor and he has a special interest in helping people manage running and golf-related injuries. He's really active in the Australian sports rehab and the sports medicine community. And you may have heard him before from many other podcasts he's been on and presentations. Luke holds a number of board positions, including on Sports Chiropractic Australia and Sports Medicine Australia. And Susanna and I met Luke at one of the Sports Medicine Australia conferences years ago, and we see him all the time on presenting at sports medicine professional development events on social media. So he's very active there, and he loves talking about running. And that's a mutual interest of ours, so we're going to get into that. I really want to, in this first episode, to talk to Luke about his background and his professional development, the pathway he's walked, and his tips for developing as a practitioner. And then in the second part of the conversation, we're going to get into a conversation about running. So, Luke Nelson, welcome to Physio Foundations.
Thanks very much for having me on, Luke. It's it's been a while back when we first met at a Sports Medicine Australia conference. I think it was up in Canberra. We were sitting up next to each other in a bus on the way to the AIS there to check that out. And obviously, common interest in running. That was easy for us to talk about. And I think that's pretty much the excuse for getting me on, really, isn't it? To just so that you can talk about running. I realised Matt last week was also another runner. So it's probably not a bad way that Susanna doesn't have to hear about it when you got guests like myself to talk about running.
Oh, Susanna does a lot of running herself. She loves it too. But it's great. It's great to have those mutual interests, and it's also really good when they cross over. Your personal interests cross over from your personal development to your professional development, which is one of the themes of this podcast. So look, before we go there, before we talk in depth about running, in part two, of course, we're dividing these up into parts to make them more digestible for the commuter. You keep them to 20, 30 minutes, but we're going to talk about running and the specifics of, how you manage and help people managing running injuries. But let's take people back to the beginning and talk about you. So can you tell everyone a little bit about yourself, your background, your interests, and where you practice?
Yeah, well, it's as you mentioned, chiropractor and an interest in sports. I graduated all the way back in 2003, so it seems like a long time ago now. It's almost coming up to 20 years, so it makes me feel very old. But when I graduated from RMIT, chiropractic being a 5-year course back then, and I soon realised that pretty much after graduation that sports was my thing that I was really interested in. I was always quite active when I was younger and played a lot of sports and never really excelled in anything, but sort of loved to be active, and so I just sort of found myself getting more and more involved in that area. And I think the other thing that I found was that I've always had a thirst for knowledge, and I found that one of the first sports medicine seminars that I attended, and just all this new information, I'm like, wow, this is amazing. I've got to immerse myself in this, and so very quickly sort of fell in love with that, and then just sort of gradually over time done more and more things, including some postgraduate study in sports chiropractic, and then also did my master's in sports science as well, and then just continuing to learn over that time. So certainly found myself, that I guess that how I practiced, morphing over time as I'd learnt more, and it's been a really fun journey, and one which, when talking on podcasts like this, it's fun to sort of look back and reflect and see where you've come from and how things have changed in that time.
So you've got a lot of postgraduate qualifications, you've done a lot of professional development, but you mentioned having a thirst for knowledge. So that's fundamental, isn't it? To be thirsty for knowledge, to be curious, to to feed that that thirst for knowledge with everything you're doing. So what about since then? So 19 years since graduating, you've done a lot of stuff, and we'll get into your clinical expertise and interests, and sort of talk about how you help people with injuries and your philosophies and approaches to working as a sports chiro. So I've got a sports physio postgraduate qualification. I finished my undergrad 20 years ago as well. How does sports chiro differ from sports physiotherapy? And everyone always asks the same question: what are the differences between chiropractors and physios? Let's ask the opposite question. Like, how are we similar?
Yes. Well, and that is it's a question I get asked all the time. If it's not from other health practitioners, it's from patients and clients that are asking the same thing. It's like, what's the difference between this, and this? And I think what we're finding is that, traditionally, if we look back in the past, and probably was around the time that I did graduate around that 20 years ago, the professions probably were in a bit of their silos, where you had chiro, you had osteo, you had physio, and then it was, this versus this. And chiro traditionally being concerned around the spine, so looking at, spinal issues like back pain, neck pain, and headaches and that sort of thing. And then physio was more sort of, things outside of that. But what we found over time is that thankfully those silos are being broken down, and there is a lot more blurring between the professions. And I think that comes off the back of a lot of the continuing education events now are multidisciplinary. So we're seeing, seeing chiros and physios and osteos and podiatrists all in the same, strength and conditioning, coaches all in the same room learning all of the same material. And then what then happens, therefore, is if we're all learning the same stuff, then, what we're implementing with our patients then starts to look quite similar. So, and that ultimately is the benefit for the patient, because it means that they're getting the most, up-to-date evidence-based care. But it does mean that there is it's like, well, you're actually looking very similar. And I don't believe that no one profession owns a particular type of treatment approach. Like, it's not like, I've had people say to me, you practice like a physio. I'm like, well, what does that mean? Does that mean that, I'm implementing this and, I'm doing rehab and that's, and whether there's, taking into account the soft tissue and it's like, well, that's just what, best evidence based care should be. So I think that it is getting a lot more blurred over time, and but I think that's a good thing. We don't need to have a point of difference of a chiro versus a physio. It's like people will sort of say, should I see, who should I see for this? It's like, well, it comes down to the practitioner. It comes down to what that practitioner is competent and confident in dealing with. If it's if someone's got a particular shoulder problem and, I think, well, that's better handled by this certain person, then off they go to that. So it comes down to more sort of specialties that way, rather than looking at titles. And that's really, when I'm looking in my sort of referral-based network, I'm looking at not necessarily what's in front of their name. It's more like, well, this person's good at dealing with that person's good at dealing with that. And I think that's sort of the future of healthcare, is it's less about titles and more about the proficiency and knowledge base of the individual practitioner.
That's so important. I'm really glad we went there, because it's a question that people are going to have when we're talking about, introducing you as a sports chiropractor. And this podcast is called Physio Foundations. But, what you've said there is the patient comes first. It's not about your title. It's not about your training. And by the way, that was 20 years ago for us. So now hopefully whatever we've done, back in the late 90s, we've been trained for our foundational training has changed significantly since then.
Yes, it has.
Anyway, so to tell us though about the experience of that, because it strikes me that you're quite forthright with going to all of the multidisciplinary Sports Medicine Australia conferences, for example, and just focusing on the research that's being presented there. And in the process of doing that, do you feel like you've broken down? You're helping to break down those interprofessional barriers, or is it just something that's evolved and you've been a part of it?
I'd like to think that's both. I'd like to think that I'm helping in some way, but I'm not naive or arrogant enough to think that it's me that's driving it. I mean, I stand on the shoulders of giants and people that have come before me as well. So, one of my mentors, Pete Garbutt, who's been involved with SMA for quite a while and headed up the ACT chair for president of the ACT for a number of years. He was someone that I always looked up to and learned a lot in my time, and he had done a lot of great work, as well as others in that space as well too. So I think I've just been, carrying on from what others have done before me. I sort of laugh and reflect back, and in occasions like this, when I first started going to SMA events, or I remember my first SMA Victoria event that I went to, and I was the only chiropractor there. There was a couple of osteos that I knew, but the rest predominantly physios. And I remember chatting to a physio during the lunch break. I can't even remember who it was, but chatting to them, and they sort of said, "Oh, well, how would you use this?" And it's like, well, how would you use it? Like, it's the same thing. Like we're taking information, we're applying it, but their sort of understanding of chiropractic at that point was, I think, it could have been a shoulder. I can't even remember what particular talk it was after, but say it was a shoulder, and they're like, well, how would you use it? What would you see there? So I think there was that. Thankfully, that doesn't happen anymore. People don't question, oh yeah, there's a chiro there. It's just like, well, there's a chiro, there's an osteo there. Everyone's just learning the same thing. So it definitely has changed a lot over the last 15 to 20 years. And that's great. I mean, how much a role I'm playing that, I don't know. But like I said, it's certainly one of the things that that I'd love to see in our profession is the integration and being part of the team, the multidisciplinary team there, playing our role when it's needed. And I'm happy to report that everything I've seen in the last in recent times has been moving towards that communication, better communication and cooperation between the professions.
No, that's so important. I'm really glad I asked you that. Actually, it's really nice to get your perspective on that. So let's talk about what we do and the foundational knowledge and skills that we use to help people with running injuries, and then we'll segue into running injuries and talk about running, the fun stuff.
Yes.
I was just before we press record, I was just telling you I've just come back from academic at Monash Uni at physiotherapy. I was just teaching at Clayton in the nice new facility there and helping the students understand the gluteal region. And we're talking about the, reflecting on what it's like to learn anatomy and then, and then forget it all again and then come back and try to relearn it and forget it again and relearn it. Yes. Lifelong process. So if you're a student listening to this and you think, hey, I can't remember all this stuff. Anatomy is vast and it's it's not easy, and that's the process. You just keep layering it up.
Yeah.
So tell us, so anatomy is one example of foundational knowledge, and it's, the structure and the function are so related, and that's one example of foundational knowledge, or I'm also interested in skills. It's a very broad question that I ask everyone. I've asked everyone so far. What do you rate as the most important foundational knowledge and skills that helps you with what you do clinically?
Yeah, look, I think, and just as an aside on that, what we were talking about before, it was sort of saying that as students, you just want to get through the course. You just want to get through, and you take it in, but then you soon forget it, and then after then you graduated, you realise, well, actually, you probably did need some of that stuff, and you go back and look at your old textbooks, or you pay to go to courses to learn the same stuff that you've been taught at uni. So yeah, students, a lot of what you do learn is important, but sometimes you don't realise the importance of that until you finish. And that includes, the most important, and it's been a common theme amongst your earlier guests as well too, Luke, with one of the important skills is communication. Really, it's so important, and probably something that in our undergraduate study we only spent, we probably spent a semester on one topic on communication, and it was sort of almost given a little bit of lip service, really, in terms of it was just like, oh, okay, you're talking about how to talk to people and body language and that sort of stuff, but it was just sort of like, oh yeah, let's just get through this. We don't need to know this, and go on. But as my years have gone on, and you realise just the importance of learning from mistakes where communication breakdown occurs and things go wrong. It's like, yeah, I could have done that a lot better. And then communication wins when you just really communicate. You felt like you've had that connection with someone, and you've been really able to explain them, and it just puts them at ease with just simply with what you're saying. So I think that communication can't be underestimated, and I think it's something that, yes, there's certainly skills that can be taught, but then there's also experience of just time in the trenches of learning, and unfortunately learning from mistakes and making sure you learn from those mistakes. That can happen. One of my favourite sayings is you've got 2 eyes, 2 ears, and 1 mouth. So look and hear twice as much as what you talk. And I think that there's that often quoted study about interrupting patients. I think it's like 11 seconds. I think they looked at a study of GPs and found that it only took them 11 seconds to interrupt the patient, whereas if they let them go off their own accord, they would usually stop by about 2 minutes. So if you let the patient go, just let them tell their story, and then you can start to chime in there. And I still find myself, I still have to correct myself. It's like, oh, don't jump in, just let them go, and so let them tell their story. So a big part of my consultations, and even spending 10, 15, even longer than that minutes with my patients is actually in that history, and just letting them tell their story, and then prying out some of the details from them there. So that's like some of the previous guests have said, it's that communication is so important, because you could be the best skilled and technical clinician and know what's going on, but if you can't explain it to the patient what's wrong with them and why they need to do the things that you're telling them to, then they're not going to abide. They're not going to comply, and they won't be a good outcome. So I think that cannot be underestimated.
So I'm trying to do exactly that right now, and that's been my approach on these podcast interviews. Maybe 2 minutes is my benchmark if I can time it when I'm doing the editing. Did I let everyone talk? Exactly. It's tempting to jump in because you've got lots of follow-up questions. Yeah. But so communication's been this big theme that's come up naturally from people. So and it takes time. Get in the trenches and learn, and don't be afraid to make mistakes. But you've got to be reflective if you're going to learn, and then look and hear more than you talk, and try not to interrupt and let people tell their story. I think there were great points that you just made about communication.
And I think one of the things that I guess accelerated my learnings in that regard as a student was I spent a lot of time observing practitioners when I was at uni. So pretty much from my second year right through to my 5th year, and even once I graduated, I was still observing practitioners, and not just chiropractors, but I was observing physios and surgeons and doctors, and seeing other professions, and taking away the way that they communicate and how they explain things to people. And I probably didn't realize it at the time, but I reflect back on that now and think, I actually learned a lot from that, just hearing how the practitioners were speaking to their patients. And then, that I guess gave me some confidence, even though I wasn't technically confident at that time, and diagnosis, I was able to sort of explain things, and I was probably a bit ahead of where I would be having done those observations.
Yeah, great. Really good information, Luke. Thanks for sharing that with the listeners and with me. Let's talk about running.
Yeah,
it's fun. We love it. There's a lot of people out there who love running, and some people who hate it. But a lot of, there's the audience of this podcast is practitioners who are trying to help people with injuries. Running's a really common cause of injury. So what got you interested in helping people with runners? In your clinic, you do some specialist running assessments, and you see a lot of runners. Is that a fair summary?
Yeah, it is. Yeah, so I see a good mix of different sports, but running would be the predominant sport that I see across, and a huge vast majority of those being recreational runners. What got me into it? Well, I was always a team sport, so I used to play a lot of basketball when I was younger, but I sort of found with the demands of practice that it just got very hard with late nights of practice, then having to get to games during the week, and so I started shifting to running as a bit of convenience, and I used to actually run when I was run with my dad when I was in high school, and I remember doing a 1500, and I was rubbish. I was near the end of it. I'm like, that's it, I'm going to get better at that. And so I remember running with my dad, and then got some fitness up there, and just kept playing more basketball, but I didn't actually return to that until I started practice. And Gradually found myself, I really started to enjoy it, and I like the convenience of it and being able to run, when I wanted to, and you could just slip on a pair of runners. And that's one of the great things about running is is the convenience factor. Got onto that, and then started doing some longer distances. I did my first half marathon and said I'd never do another one of those, and then I did a marathon and said I'd never do another one of those, and then I did an Ironman triathlon and said I'd never do one of those, and each one of those I have since then repeated and done it again. So my wife doesn't believe me now, and if I'm going to say anything like that, she just knows to ignore that. Here I am, multiple Ironman and marathon and an ultra in there as well too, and I've just sort of fallen in love with it over the years, and as you can tell, I'm sort of pretty passionate and enjoy it, and so I found myself wanting to be around those people. So I sort of just found that over time, just my caseload of more and more runners, because we just talk about running, and I was passionate about it and wanted to get them back into it, and we talk about shoes and what they're doing and that sort of thing, and so I got a real sort of kick of working with those people. And so when I actually recently switched practices, so I was previously working in another practice, and then I eventually sold out of that practice to start where I'm here, because one of those reasons was because I wanted to work with a more active population, whereas previously before it was more a general population, but also with a sports influence, whereas I wanted to have really a predominantly sports-based practice, and that's why I moved, and I've reflected and thought, who do I really enjoy? What people do I enjoy working with? And the answer to that was runners. Found myself sort of being surrounded more and more as we've gone over the years.
You do get that luxury as you go through your career, if you're reflective and if you let opportunities come to you and you make opportunities happen as well. You do get to these points where you need to ask yourself, what is it that I actually want to do? And that question was quite obvious to you. But was there a point where that was less obvious and you thought obligation to be everyone for everything for everyone, or did you always want to do it, do you think?
No, I don't. I think that, there was I guess being more a generalist. I think, for a vast majority of my, even though I was always interested in sports, it was I've only really sort of built a larger caseload of runners in the last sort of 5 years. I was always seeing runners before that, but in terms of, picking who I want to work with, I think it probably just got down to I was, I guess, a bit, get content, or you just sort of get stuck in the daily routine of things. It's like, things are busy, blah, blah, blah. And then it's only until you really reflect and think, well, what gives me, what's my purpose? What's my vision? What do I really get enjoyment out of? And it sort of took that reflection for me to realize, well, that's actually where I want to be. And that's where it was quite a big leap at the time to sell out of the practice, because things were going very well. It was a very profitable practice. Things were busy, but it just wasn't satisfying for me. And so I had to take that plunge. And I'm glad I did. But there was some stressful times in the meantime of starting up another practice. But I look back on it, and it was one of the best decisions I've ever made in my practice career to date.
It's really valuable to hear other people's experiences of these crossroad decision points in their life as well. So you one thing about you is you've got this passion for what you do and this enthusiasm. It comes across in your voice, and I'm sure that you're anyone that you've worked with at professional development events, but your patients as well, people you work with, I'm sure that's one part of what they value in you. Is not just the things it's also the relationship you develop with them. And a part of that identity is being a runner and that experience as well. So when you're working with runners, do you think you have to be a runner to really help people who run?
Absolutely.
What is it? Is there something deeper than that you could advise people on?
Yeah, so no, there isn't. Flat out, no. You don't have to be a runner to help runners. I think certainly having an understanding of the sport and an interest in what they're doing, because I don't exclusively treat runners. As I said, the vast majority of my active patients are, but I see a lot of field sport athletes. I see strongmen athletes and bodybuilders, and I'm far from one of those. So I would snap under some of the weight that those guys are lifting. But I've got a real interest in what they're doing. If there's something that I don't know, I don't know what a particular apparatus is, I'm like, well, tell me what that is, show me what that is. And they, they really enjoy that interest there. So no, absolutely not. As a clinician, you don't need to be doing the sport, but you just need to, you have an understanding of it. I mean, I remember years ago, it was probably 10 years ago now, or it was actually longer than that, 12 years ago, working with the Victorian water polo team. And I remember turning up to their first training, and the coach said to me, he goes, "Oh, you had much to do with water polo players." I'm like, I was honest. I'm like, no, not really, but I want to learn. And so he had a bit of a laugh and was happy to teach me. And it's sort of I learned more and more about the demands of that sport, and seeing more and more of them over the season and over the years. And so I got to know that. So I think being honest and upfront with the patient, that if you don't know something, then don't be afraid to ask them, because they don't expect you to be an expert in all sports. But certainly, that willingness to learn, I think, goes a long way. So I think that's probably the first thing. The next thing is and particularly runners. And we just actually put a post up on this recently that lazy health professionals that just sort of say, give a blanket or just stop running. If something hurts, what are you running for? We've all heard those stories, and hopefully our listeners have not done that to their patients. But I mean, you could take out running and insert anything. You could put gymnastics, you could put weights, you could do anything there. So it's really, as much as we can, we want to try and keep the runner running. So that may, thankfully for most running injuries, there's probably, barring stress fractures, most running injuries can continue to be run through in some capacity. Now, that may mean that we alter runs, we take something out, we might temporarily offload them a little bit, but if we can sort of try and keep them involved in their sport for as much as we can, because we know that, and also from research that's been done on other sports as well, it's part of a lot of their identity. It's who they identify as. I'm a runner. My friends are runners. We run on the weekends, and we talk about our lives. It's my mental outlet. And I actually, for International Running Day last year, I just surveyed just a handful of our patients and just sort of said, well, tell me why you run. And pretty much 90% of them, one of the reasons was the mental release that they get. And I actually didn't know, for a couple of them, I didn't know that that's what they were going to say. So I was sort of surprised to hear that common theme that ran across them. So yeah, and even I, and you and Saddam might be the same as well too. When you haven't got out for a couple of days for whatever reason, work's just being flat out, and then you're just feeling like up to here, and they might just say, just get out for a run. You just need to get out for a run, and then you get out there, and it's just like just that relief that you get from doing it. So as much as we can, we really want to try and keep the runner into doing what they want. I think it was an interesting study, actually. Even Verhagen last year, in a study, they did a qualitative study looking at a group of runners over there, and they were analysing their approach to injury, and basically what they found was that runners weren't really concerned about lowering their injury risk. They didn't really care about that, so they didn't care about so much injury prevention. They just wanted to keep running, and that their strategies that they'd try and do is that if they were injured, they'd try and run through it as much as they could. But if they couldn't figure it out, then that's when they needed help. So I think that our role as health professionals is to try and keep them running through as much as we can, but also educating them as well. And I'm a big one for that. I really love to love the educational side of things, of educating my patients, my runners, whether that's why the injury, if we've been able to identify it, why it may have occurred in the first place, and how can we prevent this from happening again. So avoid those repeated cycles and those repeated mistakes. And I think that, the injury rates are very high in running, and there can be a multitude of reasons why that's the case. But I think one of the reasons is that running is just so easy to do, and we're never really taught. No one's taught how much is too much. Like, how do we gradually build up? When should we have rest days? What's the adequate progression there? And so people just delve right into it, and that's when we see these overload injuries start to come on. So
you see people as a practitioner, and then you end up directing them to coaching.
Yeah, yeah.
Which is the load and the coaching aspect of it is where it starts. Yeah,
absolutely right. And that's why I think, if I mean, sometimes you might find yourself acting as a bit of a coach, and so those the runners that don't have a plan or don't have a coach, then you could be the one to do that. But if it's not in your skill set, then you refer to those that do that. So there, that's, I think, the prime one is really to try and keep those runners going as much as possible. And runners love to hear that. One of the first things I'll sort of say to them is, I say, look, this is what's going on. We've got this patellofemoral pain here. The good news with it, though, is that we can continue to run through this. Might need to make some alterations here, but this is what we're going to try and do. And only as a last resort will we need to have complete rest from it.
Mm. So to go back to the original question, so if you're not a runner, or you're not a water polo player, or you haven't played football before, you can definitely still help people. You need to, number one, take an interest in what they do, and you're going to be curious and ask them, show me, tell me, teach me, what is that move? Can you show me? And then, don't be lazy and tell people to quit, and keep them involved in their sport. And you can definitely do all of that regardless of whether you've run yourself or whether you're interested in it. I think that's a really important point for people to remember.
Absolutely.
A lot of it's listening and reflecting and listening to the person in front of you and seeing what their motivations and interests are, particularly that mental side of running. That comes up a lot.
Yeah, it really does. And that's where I think, no matter what the sport that you're doing is trying to keep them involved in it as much as possible. And if that can mean sometimes that, a particular runner, there might be a group run of say they're doing 20 Ks that particular week, and that runner can only do 10. We sort of try and work out ways where, whether we start with the group or whether we do the last 10 Ks with the group there, but it's sort of just try and keep them involved with their friends, because it can be, much like injured field and team sports athletes, when they're on the side of the field, doing their rehab and the rest of the team's out there running around, they can feel a bit left out. So try and keep them involved in their running clubs or involved with their friends as much as we can.
We've heard a lot of this before on how many episodes we're in, not that many. There's some really common themes that keep layering up from guest to guest, but it's great to hear it from you as well, Luke. I'm going to the listeners are probably just getting into this, and they're not going to like me for this, but we're going to pause there, and then next week for listeners, and in a few minutes for us, because we're batch recording this, we're going to come back and talk. We're going to pick right back up on that thread and go into your philosophies and approaches, and perhaps a bit more specifics of how you help people with running injuries, following on from some of those ideas you've just had then. Just quickly, so people can catch up, if they haven't met you before, if they haven't seen any of your work, where can people follow you online and find out more about you?
Yeah, so probably most active through Instagram these days at Sports Chiro Luke. Also on Twitter as well too. So I sort of use the two platforms for different things, but that's probably the best way. Otherwise, people are more than happy to email me as well, luke@healthhp.com.au. Really
good way to keep your professional development going when you've got 5 minutes spare. You can jump onto, and it depends on the quality of the people you're following. But if you follow Luke, you'll have some high quality stuff coming out. I really enjoyed the chat. Thanks very much for part one, Luke, and we'll pick up at this next week or in a few minutes.
Awesome. Thanks, Luke.